Hi, it's Tamika Chambers here with another question, and guess what? Have a priority question for you. And so what is of utmost priority? Even though the other answers may look good, but what should you do in this situation? So we have a 78-year-old client with a history of diabetes, mellitus 2, GERD, hypertension, and is hospitalized with pneumonia and rings the call bell 11 p.m., complaining of being unable to sleep and having indigestion and heartburn. Which of the following initial interventions is most indicated? So keywords, read it, pick your keywords, know what they have, some information about what they mean, and then also too, you're looking at what do I need to do? Assess, intervene, what's going on, teach. So we have 78-year-old, always encouraging to keep the age, diabetes type 2, GERD, hypertension, always include your health conditions, with pneumonia and unable to sleep with indigestion, heartburn. Those are key words. What are you going to do? What is most indicated? All right, so I encourage you to have a sheet of paper as well as something to write with. Always write down, pause, and select your answer and then your rationale. And then as you listen to whoever's going over the question, does your rationale align with the question's rationale? So do you administer an acid per PRN order, or B, administer acetaminophen per PRN order, or C, administer hypnotic per PRN order, or D, assess cardiac and respiratory status? So pause and select your answer, and then here we go again. So keywords, looking at that, diabetes, they're at risk for heart disease, right? GERD, hypertension. And this is also one of the questions that many people will trip on. They will choose something like A because they're having indigestion, heartburn, but you got to put every piece of the puzzle together. When you have diabetes, you're at increased risk of heart disease. Being of age is increased risk, and she has pneumonia. If you look at A, B, and C, all of them say do something, but the initial intervention is to what? Assess their cardiac and respiratory status. That is the answer that you want to select. First is always to assess and never to assume. Just because they're complaining of heartburn doesn't mean that's all that's going on, right? And so I wanted to give you that question, but always assess. This is not an NCLEX question. This may be a free nurse Nclexquestions.com question. And as you know, that do your questions, but also to see if you're thinking correctly. Get something to have rationales. I always usually encourage you guys to use those resources. There are plenty that are out there. I'll talk to you guys soon. Make this lifetime great.